The THOR clinical trials were designed around the perspective that FGFR3 alterations were enriched in immunologically cold subtypes. These are subtypes that have low PD-L1 expression, and based on early results of immune checkpoint inhibitors in this setting, were predicted to have a lower degree of response or benefit from immunotherapy. Erdafitinib was designed as a two-separate cohort randomized clinical trial. The first cohort that we heard at ASCO this past year was a positive trial showing that erdafitinib showed a significant improvement in response and overall survival compared to single-agent taxane in patients who received prior chemotherapy and an immune checkpoint inhibitor for their metastatic, surgically unresectable urothelial carcinoma. At ESMO, we are reporting the first results of the cohort comparing erdafitinib with pembrolizumab in patients who received prior treatment with chemotherapy but had not yet received treatment with an immune checkpoint inhibitor. The goal of this work was to determine whether there was an improved sequence, whether it was better to give erdafitinib before one might give pembrolizumab in this cohort of patients. Patients were enrolled and prospectively randomized, and the trial was interestingly negative for its primary endpoint. There was no significant improvement in overall survival compared to pembrolizumab. This was despite having an improved objective response rate and an increased progression-free survival. So it's interesting to consider how the impact of immune checkpoint inhibitors versus other cytoreductive strategies. We've seen with immunotherapy that long-term durable response or benefit that occurs, but only in a fraction of patients. While with cytoreductive chemotherapy, we've seen responses in higher numbers of patients, and yet it doesn't always achieve the durability that has been seen with immunotherapy. And when you look at the survival curves, we see that similar overlap where in the initial treatment phase, patients with erdafitinib did better. However, as we got into the later stages, the impact of immune checkpoint inhibitors and the durability of response achieved with it is certainly impacting overall survival. So overall, the outcomes comparing erdafitinib versus pembrolizumab were similar, although pembrolizumab yielded more durable response. For the future, I do think studying how to combine erdafitinib with an immune checkpoint inhibitor may be important in treating a similar cohort. And we saw results from erdafitinib with citrilimab, another immune checkpoint inhibitor, suggesting the response rates could be closer to 60%, and perhaps this could provide the impact of both cytoreductive strategies with a treatment like erdafitinib and also provide the durability that has been seen with an immune checkpoint inhibitor.